The dietary guidelines to prevent formation of kidney stones. Watch full video to get clear knowledge about your dietary plan. First, you should know the facts about kidney stones. 1. Calcium doesn't cause kidney stones. In moderation, eating calcium can actually help prevent stones from forming. 2. It's more common than you think. 1 in 10 people will develop a kidney stone in their lifetime, and 85% will develop them again within 10 years. Men develop stones more often than women. 3. Save that stone. If you pass a stone, save it for testing. There are different types of kidney stones. By knowing what specific type of stone you had, we can tailor prevention recommendations for your individual needs. 4. One size does not fit all. Kidney stones can be as small as a grain of salt or as big as a golf ball. Different treatments are recommended for the various sizes of stones. 5. Prevention is key. Changes in diet and medication, if indicated, are about 90% effective in preventing new stones from forming. Diet is the main portion to modify the kidney stones formation. Recommended dietary guidelines. Drink plenty of fluid, especially water. This is the most important thing you can do to lower your risk of getting another kidney stone. Aim for at least 3 liters of fluid each day. People with cystic stones may want to aim for 4 liters. If you are not used to drinking this much fluid, start by adding 1 extra glass of fluid each day and slowly increase the number of glasses you have. Sugary drinks such as pop, fruit drinks, and specialty coffee and tea drinks are not good choices for increasing the amount of fluid you drink. They may increase your risk of kidney stones. Try these tips to help you drink more fluid. 1. Carry a water bottle with you throughout the day. 2. Include at least 1 beverage with each meal. 3. Keep a pitcher of water on the counter or in the fridge when you're at home and work. 4. Add some cut-up lemon, lime, watermelon or mint leaves to your glass of water for a refreshing flavor. 5. Set reminders for yourself, automated emails or texts on your smartphone, or pop-ups in your calendar at work. It may be helpful to limit animal protein, including meat, fish, seafood, poultry, and eggs. Have no more than 2 to 3 servings of animal protein per day. See Eating Well with Canada's Food Guide for information on serving sizes. Choose plant-based protein sources such as dried lentils, peas and beans, tofu, nuts or seeds more often. Limit the amount of salt you eat. Choose more fresh and frozen fruits and vegetables. Whole grains, milk and yogurt, small portions of unseasoned meat, fish, and poultry and unsalted nuts and seeds are good for your health. If you had calcium oxalate stones, limit the amount of nuts you eat each day as they are high in oxalate. Limit packaged foods, ready-to-eat foods, fast foods and restaurant meals are often high in sodium. Choose foods with 15% DV or less for sodium when reading food labels. Ask for lower sodium options when eating out. Replace added salt used at the table or in cooking with herbs, spices, seasonings, lemon or lime zest juice, garlic, ginger or pepper. Eat calcium-rich foods instead of taking supplements. Calcium-rich foods include 1. Milk and other dairy products. 2. Calcium-fortified foods and beverages such as calcium-fortified tofu, calcium-fortified soy and rice drinks and orange juice. 3. Fish canned with the bones. Aim for the following amount of calcium each day, but not more than this. All adults 19 to 50 years 1000 milligrams. Females 51 to 70 years 1200 milligrams. Males 51 to 70 years 1000 milligrams. All adults above 70 years 1200 milligrams. If you need to take a supplement to meet your requirement, take the lowest dose needed and take it with meals. If you had calcium oxalate stones, limit high oxalate foods. Many of these foods are healthy choices, so you don't want to avoid them completely. When you eat foods high in oxalate, have them with a food that is rich in calcium. Foods high in oxalates include 1. Spinach, okra, beets, Swiss chard. 2. Star fruit, rhubarb, dried figs. 3. Peanuts, tree nuts. 4. Soybeans. 5. Black tea. 6. Wheat bran. 7. Buckwheat. 8. Dark chocolate. Oxalate content can vary from list to list based on where the food was grown, time of year, travel, processing, whether it was organically or conventionally grown, whether it was soaked or cooked, etc. If you want to take a vitamin C supplement, make sure you take less than 1,000 milligrams per day. High amounts of vitamin C may increase your risk of stones. Finally, it is best to avoid alcohol. If you do drink, follow Canada's low-risk drinking guidelines. 10 drinks a week for women, with no more than 2 drinks a day. 15 drinks a week for men, with no more than 3 drinks a day. 1 drink is any one of the following: 341 ml 5% alcohol beer, 142 ml 12% alcohol wine, 43 ml 40% alcohol distilled alcohol,